All right, so I'm going to start by grounding us a little bit in the food systems and nutrition policy work that we've done as a coalition over the past several years before reviewing the framework that's going to guide this particular work group moving forward. And based on what you all have shared and what I know, I think you'll see yourselves in engaging in different parts of this work in the past. Of course, to start us off, a major emphasis of the coalition has been and will continue to be our legislative policy initiatives. So what you're seeing on the screen are a few of the food-related policies that we've worked on in more recent past. Of course, folks like Janet and other coalition members that have been with us for a very long time know that there's been other initiatives before that as well, but for the sake of time, we've decided to focus on some things in the last several years. So we worked very hard on establishing and getting funding into what's called the Healthy Local Foods Incentive Program. That is a state fund that provides what's called double bucks or double value SNAP for farmers markets and other direct consumer venues for folks that use SNAP so that they can get more value for their money and access more local nourishing foods. We also worked on the Healthy Default Kids Meal Beverages Law, and that is a law that's now in place to ensure that the default beverage served with kids' meals from Illinois restaurants is water, 100% juice, or milk. Of course, parents or caregivers can request a different beverage if they'd like, but that's what would be automatically provided at restaurants in Illinois. This last session and moving into this session, our main focus has been on the Healthy School Meals for All law, which works to ensure that all Illinois schools that participate in the National School Breakfast Program and the National School Lunch Program are able and supported to provide a free breakfast and a free lunch to all of their students. So as Katie mentioned, that law has been passed and signed, and moving into this session, we're going to be advocating for the funding needed for that law so that schools can start putting that into practice. We have also been running a few major grant programs over the last 5 years in collaboration with many IAPOH partners, including several of you on the call now. One of those is called the Illinois State Physical Activity and Nutrition, or ISPAN program. ISPAN started in 2018 and actually finishes up on Friday. So we're at the very end of the 5-year grant for that work. SPAN is has been a statewide initiative with particular focus on Chicago and Cook County, the Peoria Tri-County region, in central Illinois, and the Jackson County region in southern Illinois. And included in the SPAN from the food side has been food service guidelines and the Good Food Purchasing Program, which both work to adjust the way institutions procure and serve their food to better align with their eaters' needs and the values that we collectively have around procurement. In alignment with SPAN, we were also working on the Building Resilient and Inclusive Communities, or BRIC program, for the last few years. That's had an emphasis on the southern 7 counties and the St. Clair region. And that one really worked to improve nourishing food access around the pandemic. So again, working with institutions, mostly charitable feeding institutions, to adjust the way that they are receiving their food, giving out their food, and also increasing capacity for cold storage to store more fresh health supporting options. So with both of those coming to a close, this is some of what's coming up for us programmatically over the next 5 years. We were very fortunate and happy to receive the next round of the Illinois State Physical Activity and Nutrition, or ISPAN program. That again will be a statewide initiative with 2 regions of focus. An RFP will go out to determine what those regions are. The food guidelines piece of SPAN is still included, so working with institutions to adjust their food procurement and food provision practices. Newly included are working to increase uptake of and access to produce prescription and fruit and vegetable voucher incentive programs. We are also launching the Lake Michigan School Food System Innovation Hub. That's a USDA program that covers our Lake Michigan region, so including Illinois, Michigan, Wisconsin, and Northern Indiana. And that's really working to improve access to local, nourishing, culturally responsive foods in schools around our region by increasing the local food supply chain and marketplace. So we'll be giving out grants to groups of farmers, food system players, schools, and community partners to work on that supply chain building and marketplace strengthening. So that's a little bit of where we've been recently and a bit of where we are going. And this is the food systems and nutrition policy framework that we developed collectively with many of you over the past year and a half. So this is going to guide where this work group is going. This framework has actually already informed our funded iSpan and Innovation Hub applications. We were able to take elements of this and put them into those applications so that we now have funding to work on the framework over the next 5 years. And it's going to continue to inform our work moving forward. And again, if you're able to put anything in the chat that sticks out to you that you think would be a good initial priority for this work group, that would be really helpful, and we'll be able to take that into our first meetings, and Lauren will capture that for us. So we have 2 goals for this work and this work group. The first is a meaty one. It's to establish and strengthen policies and systems to support every Illinoisan's access to sufficient, affordable, nourishing, culturally responsive, and delicious food, including by maximizing access to and utilization of nutrition assistance programs. There are 6 strategies that are falling within that goal for us of how we'd like to get there. The first is to expand school food access, including through uptake of CEP and breakfast after the bell. Both of those are included in our Universal School Meals legislative campaign. We'd also like to support nutrition and cooking education and promotion, mostly from a systems change perspective. So thinking about strengthening requirements in schools and health professional programs. I heard some notes to that in your introductions, and ensuring that what is taught aligns with learners' lives, conditions, and cultural needs and preferences. We'd also like to increase healthcare support for food provision and other social and structural influencers of health. So thinking food as medicine, produce prescriptions, and coordination with community-based organizations. And we are excited to be able to do some of that through this next round of SPAN. Expanding, guiding, and supporting the implementation of values-based procurement will continue to be a priority. We'll be able to include that in SPAN as well through support of the Good Food Purchasing Program. Support local collaboratives, linking food access sites and communities, and also building up infrastructure needed for local producers to connect to those access points. We'll be able to do some of that through the USDA grant, but would look to expand as well. And then, of course, increasing access to, uptake of, and/or allotments for federal nutrition assistance programs. So goal number 2 is more of the food system side. So building local food system supports to enable Illinois farmers, food producers, and businesses to meet our community's nourishing food needs. There's 2 strategies that fall within this goal. The first is to reduce barriers to and infuse financial support into local food production and procurement, particularly for BIPOC identifying food producers and entrepreneurs. Another strategy is to leverage and engage well-resourced sectors, so thinking healthcare, private business, to invest in strategies to support nutrition and an equitable food system. So I know that's a lot, and high level. Are there questions on anything I shared or anything rising to the top for you all from your work? I think we just have a couple of minutes, but again, feel free to start sharing out loud, or you can put thoughts in the chat as well for us to capture. And I can go back on any slides if that's helpful. Oh, we got 1 more minute. So any burning questions?
I didn't see anything about procurement policies. And, you know, as we look to changing system level changes, you know, I know we used to work on SSBs a lot, but we didn't really get a lot of uptake, at least in the Chicago market. And so I would like to see us sort of go back maybe a little bit to our roots in terms of how do we change the health system environment to be more food friendly. I know they although many, I think, in our market now have farmers markets. You know, everybody's sort of mouthing food is medicine, right? They love that as a moniker, but if the procurement policy.
Welcome back, everyone who's joining back.
Or did we just get kicked out of the break room and into the main? Is that
Yes,
what happened?
now you're back in the main room.
Yeah,
Okay.
I want to apologize to Laura and Annalisa. We're having a great conversation and Laura got cut off. I'm sorry about that.